Dear friends, now we're ready to begin. And let me repeat once again to say that you're all welcome to the COVID-19 Mental Health Workshop dedicated to social isolation and how to build resilience and promote healthy professional and personal relationships during this challenging time. This meeting is being recorded, but please note that no questions in the chat room during the Q&A session are going to be part of the recording. This workshop is presented by the DC Mayor's Office on Asian American and Pacific Islanders Affairs, also known as MOAPIA, and the Department of Behavioral Health. My name is Elena Son. I'm commissioned on the DC Mayor's Commission on Asian and Pacific Islander Affairs, and I'm a member of the MOAPIA's Mental Health Task Force. Before we begin, I'd like to go through some housekeeping arrangements that relate to the Q&A session. When you look at your video screen, you will see several circular icons in the bottom section. Click on the blue circle icon with question mark to pose your question. In the bottom right of your screen, type your question in the chat box and click send. Questions are welcome throughout the webinar. We also invite all attendees to submit requests for future mental health topics and encourage your family, friends, and colleagues to attend them as well. Can we please also ask everyone to mute their microphones so that we can have a smooth presentation? Thank you. Today's event is timely. The original plan was to hold it in May, and then came COVID-19 and the new norm of social distancing, social isolation to protect our physical well-being. For those of you who don't know, due to the public health emergency declared by Mayor Bowser, all DC government communications and approval processes had to be filtered through the Joint Information Center and be approved by the Mayor's office. And we're extremely grateful to Mayor Bowser and a group of DC government officials and speakers who made this event possible tonight. And these are Ben de Guzman, MOAPIA's director, Dr. Richard Bebouth, Deputy Director of the Adult Services at the DC Department of Behavioral Health. Our speakers, Dr. Anita Gadhia-Smith and Dr. Ronald Smith. Erica Cunningham, Director of Communications at the DC Department of Behavioral Health. Gok Trin, MOAPIA's Director of Operations. Lee, MOAPIA's Community Outreach Specialist. And our two miracle workers who have worked tirelessly on bringing all of you in this room. And these are Henry Duong, MOAPIA's Program Manager, and James Yu, MOAPIA's Public Information Officer. And special thanks to my very dear fellow commissioner, Karen Kwok, whose professionalism and knowledge helped frame this event and turn the idea into reality. So how do we build resilience and promote healthy professional and personal relationships during this challenging time? Well, without further ado, let me introduce the first speaker, Ben de Guzman. Ben de Guzman is the Director of the Mayor's Office on Asian and Pacific Islander Affairs, MOAPIA. He comes to MOAPIA from the Mayor's Office of LGBTQ Affairs, where he served as the Community Outreach Specialist. He has been a leading voice at the local and national level on issues of racial equity, immigrants' rights, veterans' affairs, and LGBTQ justice for 20 years. As an advocate for equity and recognition for Filipino veterans of the Second World War, he led successful legislative campaigns that secured financial support for these veterans and the Filipino veterans of the Second World War Congressional Gold Medal. As principal staff at the National Queer Asian Pacific Islander Alliance, he spearheaded efforts to promote national LGBTQ campaigns on comprehensive immigration reform and a national LGBTQ Pride Month campaign from AAPI advocacy organizations. Thank you so much, Ben, for your leadership and advocacy, and the floor is yours. Thank you.
Thank you, Elena. I wanted to make sure people could hear me. Thank you so much to everybody who is joining us tonight. We haven't had a whole lot of time to do outreach for this, and within a few short days, over 100 people signed up, and more than 50 of you are here tonight. So we're so pleased that people have found this useful. As Elena said, today's event is a result of the work of the Commission on Asian and Pacific Islanders Mental Health Task Force and our support here at the Mayor's Office on Asian and Pacific Islander Affairs. The Mayor's Office on Asian and Pacific Islander Affairs, our mission is to improve the quality of life for our district's Asian American and Pacific Islander residents through advocacy and engagement. We work with our commission, which consists of private citizens who have been appointed by the mayor to engage our API residents and make sure that they're fully part of the entire fabric of public life here in the district. So As Elena said, the conversations for this event started initially with a focus on the AAPI community, and we remain mindful of the specific ways that the pandemic has particularly affected the residents that we serve in Chinatown and elsewhere. As early as January, our businesses in Chinatown began recording instances of economic downturn as news about the coronavirus began to be circulated, and as people began to, have questions about sort of the impact that the virus was going to have. We observed at the time that those businesses were really the canary in the coal mine, because as we've seen since, obviously, everyone in the city is now experiencing the impacts of this virus. However, it's important to note, as the mayor has noted from the very start, the very first time she spoke about this virus, viruses don't discriminate, and neither should we. As we planned this event then moving forward, in this moment of when the mayor declared the public health emergency, we realized it became important not just for us to talk about the AAPI community, but this event became an opportunity for the entire district to come together and to think about mental health as health. We've spent a lot of time, coughing into our elbows and wearing masks, and we have to make sure that as we're finding shelter in our homes, that our homes become a place where we're able to recharge mentally as well as physically. So we're proud to open up this discussion as an opportunity, again, for the entire district to take this moment to take stock of the resources and services that are available to us to make sure that our minds and our hearts are free and healthy from any virus as well. Finally, I just wanted to say that kind of in this moment, another thing that the mayor says often is that we're all in this together. And, we've spoken a lot about our DC values of solidarity. And, there's no time to put our values to the test more so than in a moment of adversity. And so I've been really proud of the way our mayor has responded to, the challenges in front of us. I'm really proud of the way that our staff and our commissioners have stepped up to make sure that our residents are being taken care of. And I'm proud and glad for the support of our speakers tonight to come forward as well to have this important conversation. So on behalf of them, on behalf of the mayor, I just wanted to say thank you to all of you for coming here and being part of tonight's conversation. I did want to turn it back to our moderators, and Elena didn't get to tell you about herself, but I wanted to give you a little bit of information about our two commissioners who will be moderating tonight's discussion. Elena Son, whom you've heard from already, is the Executive Director of the American Uzbekistan Chamber of Commerce, the U.S. Kyrgyzstan Business Council, the U.S. Tajikistan Business Council, and the U.S. Afghanistan Business Initiative. Her work is focused on helping U.S. Fortune 100 and Fortune 500 companies secure contracts and projects in Central Asia and representing their interests before the governments of the U.S. and Central Asia. This is actually Elena's second tour of duty with us as a commissioner. She was on our commission a couple of years ago, stepped away, and we're proud to have her back. Karen Kwok is an advocate, educator, and collaborator in public health and family nursing. Her passion for public service includes wellness programs and patient care services in California's Yolo, Fresno, San Mateo, and San Francisco counties, as well as the Ministry of Health in Sub-Saharan Africa, Asia, and Latin America and the Caribbean. She's gotten around. In cultural humility, she finds joy in connecting with her patients of Asian, Latino, and African American descent. With over 20 years committed to patient health advocacy in resilient communities, she now serves as a nurse practitioner in Washington, D.C.'s Howard University. We're proud to have her on our commission, and I'm proud to introduce her to you now to take us into the next part of our program. Karen?
Thank you, Ben, for your introduction. And I want to echo this other speakers, welcome to all the attendees here. Thank you so much for spending your Friday evening with us here on East Coast time and afternoon in California if you're here with us. And I am hoping that you're staying healthy and safe during this time period. I'm really glad, honored to be part of the commission in its hard work, in its advocacy for the Asian Pacific Islander community in DC and making a difference. Through this kickoff of the workshop series, we want to reframe social distance as actually virtual solidarity in COVID response and recovery. With the next speaker, as we are queuing up his slide presentation, I want to introduce Dr. Richard Bebouth, who is the Deputy Director of the Department of Behavioral Health. He has a wealth of knowledge in understanding and utilizing the safety net system here in DC. In his internship after receiving his doctorate in psychology from University of North Carolina, Chapel Hill, he worked at St. Elizabeth's Hospital here, as well as with Unity Healthcare in the Department of Corrections. His breadth and depth of knowledge of communities that are dependent on the safety net services will help inform our discussion today. And I turn over the floor to him now. Thank you.
Thank you so much and welcome. I wish very much I could see the folks that are listening because that's such a big pleasure of speaking, but thank you for joining us. I want to commend and thank the Mayor's Office on Asian and Pacific Islander Affairs to start with by saying that obviously this is very timely, but I congratulate you on recognizing the centrality of behavioral health. And as Ben said earlier, behavioral health care is an essential part of healthcare. I want to talk when the slides come up about the DBH role, the Department of Behavioral Health, and our role in the city, and more specifically with respect to the COVID-19 crisis. But I'd like to start with a little bit of a wider lens. If I could have the next slide. And this is in case I don't get back to it. This is what my communications director told me I had to put on the screen. This is a slide talking about the importance of maintaining our mental health during this crisis. And the tips here that you can see from the icons include reaching out for help. And that's not just formal help, but reaching out to people. And I love the language of virtual solidarity. Exercise regularly, limit our time spent in public spaces. If working from home, arrange it so that you have time to work in a designated space. And then when you're done working, to leave that space so that you have some separation between work, and establish routines. Get up and shower. My boss is up and hair and makeup. I often don't have my hair and makeup done by 8:30 in our kickoff call, but those routines are important. And we'll hear more about this later. Definitely adopt practices in terms of grounding and mindfulness. And last but not least, manage your media diet. We are all inundated by this. If I can zoom back out for a minute, though, and look at the next slide. Everybody instantly recognizes what the pink ribbon is about, right? If you can go to the next slide, we all know that this is a symbol for breast cancer awareness. If we were live, I would poll you to go back one. You already gave the answer away. But I would poll you to ask one in how many American women will be diagnosed in their lifetime with breast cancer. And next slide shows that the answer, according to Susan B. Komen, is 1 in 8. 1 in 8 American women, and yet every one of us knows someone who's been affected by breast cancer. Every one of us immediately recognizes the pink ribbon and its symbolism. If you go to the next slide, indulge me in a personal moment. My mother actually is a double breast cancer survivor, and I have one of these hats, and she has one of these hats at home in Ohio, and I'm proud of her courage in that fight. If you go to the next slide, I have a question. And again, if we were live in a room, I would ask, who knows what ribbon color is used to signify mental health awareness? And even in a room full of behavioral health or mental health specialists, most people don't know the answer. The next slide shows the color that is used to symbolize behavioral health awareness is this sort of lime green or Kelly green. And I love this about breaking the stigma, which is really what I want to talk about. If you go to the next slide and ask yourself, 1 in how many Americans will have a diagnosable behavioral health condition this year or in their lifetime? And most people don't know the answer to this. With breast cancer is 1 in 8 American women. Next slide shows at least 1 in 4 Americans will have a diagnosable behavioral health condition in their lifetime. And that's really, honestly, at least. Something like 1 in 5 Americans, adults, have a diagnosable behavioral health condition in any given year. Why does everybody know the pink ribbon and almost nobody knows the green ribbon, even though twice as many American adults will be affected by behavioral health conditions? The next slide, please. Thank you. The answer is simply stigma. And we're familiar with this word, but it's useful, I think, to go back to look at the roots. The Greek word for to mark or to brand, the origin of stigma. And today, especially on which happens to be Good Friday in the Christian tradition, stigma is also used to refer to the marks of the wounds of the crucified Christ. Stigma prevents us from talking. Stigma, despite the fact that 1 in 4 Americans in a lifetime or 1 in 5 in a calendar year may have a diagnosable condition, our behavioral health literacy is extremely low. Stigma motivates fear and rejection and avoidance of people showing symptoms. Stigma leads to discrimination and disenfranchisement in all kinds of non-specific ways, but specifically in terms of housing opportunities, job opportunities. It leads to low self-esteem, isolation, hopelessness. And for me, most importantly, shame and stigma lead people to conceal symptoms and delay or refuse to seek treatment altogether. If you go to the next slide, please. I have lived for probably my whole adult life with low-grade chronic depression. And in my 30s, I'm a trained psychologist. I was used to talk therapy. I thought I could talk my way out of my depression. It took me years with a lot of support to decide that maybe I couldn't talk my way out of it and that I would be helped by trying an antidepressant. I was fortunate that the very first antidepressant I tried, Prozac, worked. I continue to take it. It has made my life immeasurably better. Next slide is a picture of a teenager who did a TED Talk, and he said it extremely well. Depression isn't about being sad when something is wrong. It's about being sad when everything is right. And in my struggle to come to grips with my depression, I couldn't explain it because I look around and everything was right. I I had no right to be feeling the way I felt. I felt alone and ashamed, and I hid it. I went to work every day. But my depression robbed my life of all of its color. Everything faded to gray and to black and white. In the next slide, when I was wrestling with that decision and trying to understand my depression and how to treat it, I knew every diagnosis in my family's history, right? I knew about every polyp, every breast cancer, every skin cancer, my grandfather had a pacemaker, my other grandmother had breast cancer. Years after I decided to start pharmacotherapy for my depression, my Uncle Bud, I happened to mention it just in passing, and my Uncle Bud said, well, you know about grandma, right? Go to the next slide. I didn't know about grandma, but my grandmother had been treated many times for depression, including with electroconvulsive therapy. I was furious and about the fact that nobody had told me until I realized, even though I was in the business, even though I was a licensed psychologist and trained, I wasn't asking anybody. Who knows? I think I'm depressed. Anybody in the family ever been depressed, and what was helpful in terms of their treatment? I didn't ask, again, because of stigma. Next slide, please. It begs the question, why do we think about behavioral health conditions differently from mental health conditions? In the next slide, if my son, this is actually not my son, but it does look sort of like him. If my son came home from camp with a broken arm, we would have his cast wrapped up like that, and we'd walk around with a Sharpie pen and ask everybody to draw on it and celebrate his bravery. The next slide, if my son came home from camp with some experience of trauma and anxiety, we would whisper about it. We wouldn't share that. We wouldn't talk about it, again, because of stigma. Next slide. I want to say a couple of things about mental illness. First of all, it can happen to anybody. Some of you may recognize this picture. It's from the front page of the Washington Post. The next slide reveals why I've selected it. This was a man who was on the streets of DC, and frankly, at least as of a couple of weeks ago, still is, who went to court on an arrest charge for sort of a nuisance, disturbing of the peace charge. The judge started to explain to him the proceedings, and he said, yes, sir, I know. I went to Harvard Law School. Nobody in the room believed him until the judge looked down the nose through his glasses and said, yes, sir, I remember you. I did too. They were classmates. This man was a classmate of our Chief Justice, John Roberts, in law school. Part of this story, I think, is about the high cost of delay in seeking healthcare and behavioral healthcare. This was a brilliant man who was able to mask his illness to his own detriment. We actually don't know a lot about what happened between law school when his classmates remembered him for his sophistication and always coming to class in jacket and tie. The delays we could talk for a long time about, but are costly in terms of quality of life, in terms of relationships, in terms of neuronal pathways and structural changes in the brain. We've got to talk about these things. The next slide is, I won't tell you the whole story, but a brief celebration and is intended to make the point I want to make, which is that treatment works. The young man on the left is a friend of mine. We celebrated with his father, who was a Washington Post and Pulitzer Prize-winning writer. Kevin on the left was struck during college with the onset of a psychotic spectrum illness. It took a long time for him to accept and get the appropriate treatment. but he now lives in Fairfax County and works full-time as a peer support specialist on an ACT team, participates actively as an uncle in his nieces and nephews' lives, supports himself in his own apartment. These are brain disorders. These are brain-based disorders. And the next slide, I will just go through these quickly, but if you look at trauma, you can see in these images the difference between a healthy brain and a brain, someone who has been diagnosed with PTSD. The next slide shows the difference between someone screening positive or negative for trauma. The next slide shows the difference in the brains of two twins, one who is healthy and one who's diagnosed with schizophrenia. The next slide, probably because of my own history, is the one that sort of moves me the most. Look how much brighter that the activity, the metabolic activity is in the brain of the person who's not depressed. It's absurd for us to differentiate between mental health, behavioral health conditions, and the rest of health. If we go ahead, the next two, slip through the addictions again, the next one, you can see the differences between healthy and addicted brains. The next slide is about, again, we recently celebrated 10 years since the Mental Health Parity Act was passed. But the reality is that in terms of our values and attitudes and in terms of our funding, we have not achieved parity with respect to behavioral health and physical health. I want to just quickly, the next two slides are about childhood trauma. I just want to reference, and the next one, I just want to reference a body of literature that many people are aware of on adverse childhood experiences. This was produced by Kaiser Permanente Foundation and CDC. The body of research basically shows that if you go to the next one, or skip the next slide and go to the following, a simple count of the number of these categories of bad childhood experiences turns out to be one of the very best predictors of chronic illness in adults, heart conditions, diabetes, hypertension, obesity, and even early death. If bad things happening in childhood trauma, are the best predictors of these adult health conditions and early death, how dare we try to talk about these separately? Let me talk more narrowly in the next slide, just quickly, about the role of the Department of Behavioral Health. In terms of our mission and traditional scope, I should have started by saying that on behalf of my director, Barbara J. Bazran, it is my pleasure to represent her and to represent this department. We are the State Mental Health Authority. Much of the service that is provided is through 91 certified provider partners. We provide mental health, substance use, and co-occurring disorder treatment. We really are the public safety net and primarily serve directly and through our partners those on Medicaid and who are underinsured. So our historical focus has been primarily on people with severe and persistent mental illness. We operate the psychiatric emergency room, an urgent care clinic, 24/7 community response and crisis team. We are the assessment center for entry into residential and outpatient drug treatment. And we're the lead agency on the Live Long BC strategic plan for the opioid response. More narrowly, let me just talk just in the last couple of months, and I would complain about the week and the work that I had to do this week to put together a submission for a $2 million federal emergency grant. But quite honestly, I just got news that it's been uploaded and submitted and it's behind us, and I'm grateful for that. But we're working hard to bring in recognition of the of the behavioral health impacts of the COVID virus, we've applied this week for a $2 million state award. We are doing outreach to support individuals who are COVID positive and or awaiting test results while at home for 14 days. We've supported drive-up testing. We have the mental health hotline, which is in my slides, and I'll repeat the number when we get to the last slide. But we are also just in the last day working to stand up a response in partnership with the Office of the Chief Medical Examiner to support the grief and loss of families who are directly impacted by the deaths of loved ones due to the coronavirus. You see in the next slide, this is a picture of some of my colleagues who were on site at UMC supporting the drive-up testing. The next slide, the next two slides, stay there for just a second. Last night, thinking about this presentation, I found this. Taraji P. Henson was on The Tonight Show this week and promoting this. She has a foundation that supports behavioral health. The next slide shows the Boris Lawrence Henson Foundation, and the language struck me about breaking the silence and breaking the cycle. I also point those out to say that for those who are impacted by the stress and anxiety and fear and grief and loss, because the Department of Behavioral Health has really focused on the public safety net, I do want very much to point people to mainstream resources. Use your employee assistance programs. Talk to your primary care physician. Increasingly, we'll hear about this, but increasingly behavioral health is getting integrated into primary care. But then again, on the last slide, I would again point out, it's a little hard to read here, but the number for our DBH mental health hotline, which includes a thread that gets you to a clinician if you're wanting to talk specifically about anxiety related to the COVID crisis. But that number is 1-888-793-4357, and we'll publicize that after. But it's also 888-7-WE-HELP. And we're here to support and protect you through this. We will get through it together. I will close by just quoting one of my favorite quotes, which is that we are all in the same boat on a stormy sea, and we owe each other a terrible loyalty. So again, I want to thank the Mayor's Office of Asian and Pacific Islander Affairs for this opportunity and for this gathering. And to say that community and belonging and connection are the best antidotes to the isolation, but also to trauma. They're actually protective factors that mitigate against the development of traumatic reactions. And as my life partner says, we are in the midst of a collective trauma. So again, thank you all for joining us and being part of this community. We are all in the same boat on a stormy sea. Thank you.
Thank you, Dr. Richard Bebouth, representing the Department of Behavioral Health here in Washington, D.C. And we will have a chance to hear from him as well in the Q&A dedicated session at the end. I first wanted to recognize that the Department of Behavioral Health helped prime this mental health wellness kickoff of the workshop series. out of invisibility in sharing his very personal story, Dr. Richard Bebouth, helped us appreciate and understand how common our feelings of sadness can be. And through this crisis of response and moving into recovery, how can we tap into social emotional wealth? These very normal feelings of stress, of grief, of uncertainty, that definitely has some impact on ourselves as individuals and our relationships. And so I'm going to pause before Elena will be introducing the two speakers, Dr. Anita Gadhia-Smith and Dr. Ronald Smith. I did notice that there were a few questions in the Q&A box. So we'll touch on a few of those questions, but know that throughout the presentation, you can send them into the Q&A box and have a chance either directly after the speaker finishes their presentation, as well as the dedicated Q&A session. We will be addressing any concerns or questions that you bring up. So the first question was whether a patient or a friend who has bipolar and might be presenting with manic symptoms, what can one do? A concerned family member, friend, and maybe we might back up because the audience might not know what a manic presentation might mean or how it might present. So Dr. Bebouth, would you like to answer that first question?
Sure, thank you. So thankfully, actually, many more of us know about bipolar depression. Bipolar disorder is what is used currently to describe what used to be called manic depression. There are people who have a primary depressive presentation, but have a history at some point of mania or hypomanic symptoms where they have extraordinarily high energy. They may need little sleep. They may be impulsive during periods of mania, engage in impulsive spending or high-risk behavior. So I think a couple of things. One is that while we all recognize signs of a heart attack or choking or a stroke and so forth, and we feel empowered to say something and to do something about it, because of stigma, we often do not feel, first of all, because of our illiteracy, behavioral health illiteracy, and because of stigma and shame, we often try to look the other way. So I think directly engaging the person in what you're seeing, just in a descriptive way, and to say, I'm worried about you. I've noticed that you're talking very fast. I noticed that you were emailing at 3 a.m. What do you know about that? And not be afraid to just say, out of a place of loving concern, here's what I've seen and here's what I'm worried about. If somebody's not approachable, the number that I already shared, the 888-7-WE-HELP, in addition to having the COVID anxiety sort of warm line function, that same number functions as part of the National Suicide Prevention Hotline Network. That same number is a way that people can access emergency psychiatric and mobile psychiatric services through by the district Department of Behavioral Health or through partners. So that is a 24/7 hotline where consultation is available about helping people to access services.
Great. And a second question before we move on to the other presenters was specifically regarding the breakdown of the $2 million grant that what would be the services that DBH might be providing through that grant?
Sorry. This is a formula that was established by the federal granting agency, the Substance Abuse and Mental Health Services Administration. And they're requiring that 70% of the service dollars be directed toward gaps for people with serious mental illness, those with substance use disorders, or those with co-occurring mental health and substance use disorders, but aimed at sort of the more severe. 20% of the dollars are to be used for people with acuity or severity less than serious mental illness. And that's the recognition that this collective trauma is going to have wider impact, and not just on people that may already be accessing or need DBH services. And then 10% of the money is actually directed to provide behavioral health support to healthcare providers who are obviously overwhelmed. They're working hard. They are putting themselves at risk. They often, as we see on the news, every time you turn on the news, feel as though they don't have adequate PPE. So 10% of this money, if awarded, and we're reasonably confident about this, will be to stand up services, specifically mental health and substance use services for healthcare providers.
Great, thank you for that follow-up. And with the time that we have, I'm going to relinquish the floor to Elena in introducing the other speakers, but possibly the other speakers might weave into their presentation answers to some of the other questions that are in the chat box. And if they don't get a chance to do so, we can dedicate the Q&A session for addressing that question more specifically, which was regarding the taboo of mental health, specifically in the older generation in the Asian Pacific Islander community. And I'm waiting on an attendee to specify in their question what mild to moderate SMI might mean. But let's listen to what the Smiths, Dr. Ronald and Anita Smith, will be presenting, and we will also get to the Q&A session. Go ahead, Elena.
All right. Well, thank you so much, Dr. Bebouth, for a very moving personal presentation. It really makes all of us be more considerate about what we're going through and what we feel, and make mental health our top priority. We all try to look out of our physical appearance, but we are very reserved when it comes to our mental appearance and our mental health being. So without further ado, let me introduce our next speaker, Dr. Anita Gadhia-Smith. And she has a very impressive bio, so I would like to share it with all of you so that you know her background and understand why she speaks so passionately about her issues. Dr. Anita Gadhia-Smith is a psychotherapist in Washington, D.C., specializing in addictions, recovery, and relationship issues. Dr. Gadhia-Smith is also the author of 5 best-selling books on From Addiction to Recovery, Practical Therapy, Live and Laugh Each Day, How to Stay Together, and How to Heal Emotional Trauma. She's particularly effective, discerning, and insightful about current issues that have a psychological impact on individuals and couples. She has served as a consultant to the United States Congress in parity legislation for substance abuse treatment. She has also spoken nationally and internationally on radio, television, and other media as an expert on a variety of topical subjects. One of the things that distinguishes Dr. Anita Gadhia-Smith is her own personal history of addiction, as well as 3 decades of recovery. She has had a first-hand experience of a spiritual, physical, and emotional bottoming out, followed by a remarkable story of recovery and commitment to helping others who suffer with alcoholism, addictions, and relationship issues. Her history and training allow her to approach her work, her perspective, and her writing as a healed healer. Her story is one of redemption. She is a unique therapist who has become a successful, self-actualized woman by way of an intense struggle and personal journey in her own right. Her insights and wisdom are tremendous and inspiring about how to obtain and maintain ongoing balance in our lives. Dr. Gadhia-Smith earned her undergraduate degree from the Johns Hopkins University and graduate degrees from the Catholic University of America and Southern California University. In her practice in Washington, D.C., Dr. Gadhia-Smith works with adults and adolescents in individual, couple, and family modalities and says, therapy is a journey through which we find our authentic selves and become the best we can be. Through therapy, profound and lasting change can occur. My approach is to meet you where you are and help you to move towards your goals, overcome obstacles, and achieve maximum growth. So for those of you who don't know, Dr. Gadhia-Smith is actually married to Dr. Ron Smith, who is our next speaker, who is going to talk about the addictions. And I know that you have 3 children and you have 6 grandchildren. So you're a living example of the happy relationship. And here you are. So the floor is yours, Dr. Gadhia-Smith. Thank you.
Good evening, everybody. I'm Dr. Anita Gadhia-Smith. Thank you so much for including me in tonight's event, and really appreciated our first speaker, Dr. Bebouth. The issue of stigma is one that I have witnessed a lot of change over the last 30 years, and not only in addiction treatment, but also mental health treatment. There was a time when I was growing up when it was a shameful thing to go to therapy, and people used to think it was for the severely mentally ill, and that regular people didn't do that because they didn't need therapy. And over time, things have changed where there are a lot of people who go to therapy who have serious mental health issues, and there are many people who also have less serious, but they don't want their issues to become more serious, and they start working on them sooner and earlier and are able to maximize potential in their lives and to live more fully. And I've had the honor of being in private practice in both Georgetown and Bethesda for well over 20 years, and have had just a great time working in mental health. It's really, really meaningful and fun. And today I was asked to talk about healthy relationships. And as was mentioned in my introduction, I am also a person in long-term recovery from addiction, recovery for 30 years. And I remember some time back, one of the things that I learned that was very powerful was that the 2 barometers of mental health are the ability to love and the ability to work. And that if you can do those 2 things, you can create a meaningful and satisfying life. And so relationships really are one of the most important things that we do in our life. If I actually believe probably the most important, and one of the most difficult things that we do, because we are all so very human, and we have emotions and feelings that come up in relationships, and it's not always easy to deal with them. So what I'm going to talk about tonight are 5 keys, and there would be other things, but I'm just going to focus on 5 keys to having healthy relationships. The first one is self-care. And I have 4 cornerstones of self-care that I recommend to my patients. And they are sleep, exercise, good nutrition, and mental health care, including social support. And these sound like very simple, basic things, but it's amazing how difficult the simplest things can be. And I think one of the gifts of the pandemic that we're in is to be able to slow down and think about what is really essential in our lives. And we're all right now not rushing around and racing with our to-do lists. So we have a chance to really focus on what matters. And I, with sleep, there are a lot of reasons that people do or don't sleep. And sometimes an underlying mental health issue can be a reason for disrupted sleep, sometimes being too busy, but it's just really important to prioritize sleep because it's the linchpin to everything in your physical and mental health. It greatly impacts the hormonal systems and mood and frustration tolerance and stress and energy level. And if you had to pick one out of those four, I would say start with sleep and work on that first. Exercise is the second, and it doesn't have to be a gym. Just walking, like the recommendations are 30 minutes a day. I myself walk 45 minutes a day, and I do 3 miles every morning, and it energizes me and lifts me up in a way that caffeine cannot do. Um, the nutrition piece, I think, is very critical and underrated in terms of the role of nutrition and mental health. There are many mental health conditions that are greatly improved in having better nutrition. Just sugar and caffeine are two things that are heavily laden in the American diet that greatly contribute to anxiety, poor sleep, restlessness, irritability. Some of us can tolerate those things and some of us can't. And we have to also look at how our body responds over the course of time as we get older, because our nutritional needs change. The amount of food that we need changes over time. Most of us need less food as we get into middle age and beyond, which is where I am at 57. And so we have to keep adjusting and listening to our bodies in order to make good choices and to have optimal mood and energy and brain function. Mental health care would be the fourth component of self-care. And I really appreciate that it was discussed that the stigma has come down, because it is. It's no longer, shameful or a bad thing to seek mental health care. We've had so many people come out in the public eye and talk about it. I remember when I wrote my first book in 2007, which was 13 years ago, I came out as being in recovery and also being a therapist. And a number of colleagues approached me and said, "Are you sure you want to do that? Because, you're revealing things about you that are very personal." And I said, "Absolutely, I do, because who I am and my truth is more powerful than a lot of things that I have learned in textbooks." And I just felt that it was really important to just tell the truth. And in my case, it had been a very severe drug addiction as well as alcoholism, including cocaine and heroin, before heroin was very common as it is today. Back in the 80s, it was a much more stigmatized addiction. And even after I got into recovery, it was 5 years before I talked about some of the drugs I did, even with other people in recovery, because I had so much shame. And over time, a lot of that shame just gradually went away. And the way that shame vanishes is by telling the truth. Speaking the truth is how the stigma goes away and how we release ourselves from shame. And we get to do that in therapy and with people that we trust and spiritual advisors. The second key to healthy relationships is to do some work on your family of origin and childhood issues, especially if you have had neglect abuse and trauma. And I think that very few of us manage to escape childhood without some sort of difficulty and some sort of trauma emotionally. And there are different levels and different degrees of trauma. But what happens with relationships, and it could be a couple or it could even just be good friends, is that the unaddressed issues and wounds from childhood will come up and present themselves once you get into an intimate relationship. Many of you have maybe been in a relationship and it goes really well for maybe the first 6 to 9 months, and then it starts to get real and it starts to get harder, and you have a hard time handling yourself and the other person, and a lot of things come up. And so a lot of what comes up is what has been repressed, and the unhealed childhood wounds come up, and they can destroy a lot of relationships if they're not attended to, recognized, and dealt with. And that is best done with some kind of professional help or self-help groups. The third key to healthy relationships is to know what your deal breakers are. Now, there's some very common major deal breakers that many of us think of when we think about this word, like violence, abuse, or active addiction. But sometimes people have their own deal breakers that don't fall into those major categories. If you have any of those major categories going on right now in your relationship, get help right away, because these things don't get better, and left untreated, they only get worse over time. And one of the issues that comes up in relationships a lot that is most problematic is managing conflict. And it takes time to understand yourself and your own responses to conflict, your partners, and how they mesh together. So work on these things when you ask for help. Know your deal breakers, know your bottom lines, and go for something that's a good fit. You know, people are not necessarily good or bad people. Relationships are all about the fit. It's all about finding someone who your crazy can fit with their crazy, and you can make it work. Because we've all got some crazy, and we've all got some deal breakers too. The fourth key to healthy relationships is what I call taking personal responsibility. I have a lot of people come into my office either by themselves or with a partner, and they come in and talk about what the other person is doing. And without really focusing on yourself and what you're doing, it's very hard for a relationship to get healthy and stay healthy, and for a partnership to work. What works better is when each person looks at their own part and takes responsibility for their part of the equation, and then works on themselves. Rather than working on the other person, work on yourself. Take responsibility for your part of the dynamic in the relationship, and also take responsibility for your own joy and happiness. We're not with somebody for them to make us happy. We have to take responsibility for creating what we want in our life, for doing something with our life, for making something of ourselves. We cannot live through the identity of our partner, right? We're all here for a very short time, and there's nothing like COVID to remind you of that we don't know how much time we have, and it's really important to take responsibility and do whatever you can to fulfill your potential and try to leave this world a better place.
These are wonderful remarks. Yeah.
Thank you. And so part of that is creating meaning and purpose for yourself outside of just being someone's partner, but actually finding your meaning and purpose. And the fifth key to healthy relationships is to pursue ongoing personal growth. You want to have a partner who is willing and able to work on themselves. And if you do the same, if you are committed to your own personal growth, you will grow and continue to flourish over time. And in a healthy relationship, you may not always give the other person exactly what they want, but in a healthy relationship, each person will become a better version of themselves. And each person will grow because of it. And sometimes that's out of joy, sometimes it's out of pain. But if you're growing and becoming more fully actualized as a person in a relationship, then it's probably one that's good for you. So those are my 5 keys, and I'll leave you with those, and happy to take any questions.
Sure. Thank you so much, Dr. Gadhia-Smith, and to our audience. There are questions that are coming in, and so we're just going to finish with one more presentation by Dr. Ronald Smith, and we will move into the questions and answers. And I think what you just said, Dr. Gadhia-Smith, is a great opportunity for the next presentation on addictions. And so when we embrace the change, it's called an opportunity. But when we resist the change, it's called the challenge. So we're going to talk about one of the challenges, which is addictions. And Dr. Ron Smith was the first physician trained in the critical care medicine by the U.S. Navy. He became one of the first physicians involved in Navy alcohol treatment and was instrumental in the founding of the Betty Ford Center. During his time, he and his brother Richard Smith worked together to start the Venus Foundation, which offered free substance abuse treatment at Santa Anita and other racetracks. His interest in addiction and recovery led to an interest in psychological growth during the middle and mature years of life. And after returning to active duty as a psychoanalyst, he contributed as medical consultant for the Honorable Jim Ramstad for the Ramstad-Willstone Bill, which was eventually passed in 2008 as the Parity Act. As an emergency physician, he accompanied Senator Arlen Specter traveling on his worldwide congressional delegations. And Senator Specter enabled Dr. Smith to meet many world leaders and contribute significantly as a political psychologist. Dr. Smith has been annually recognized by the Consumers Research Council as one of America's top psychiatrists in psychoanalysis and alcoholism. And Ron will continue his interest in political psychiatry. He will work in his private practice and continue to lobby for the treatment of our homeless and mentally ill in hospitals instead of jails, for decriminalization of addiction, and for NCAA football player on the field. He will also continue his quest for a Kentucky Derby winner. Dr. Smith, the floor is yours. Thank you.
Thank you. Is the speaker, can you hear me?
Yes, we can hear you, Dr.
Good,
Smith.
good. Can we have the first slide, please? Thank you for the opportunity to think with me. There's so much going on right now that brings us to hyper awareness and the opportunity to value our lives and think together and decide what's important in our life. And that's really the interest that I've developed over the years, 20 years in and out of the Middle East, and watching people grow in recovery. The addiction part is not that interesting, the drinking and the drugging. What is interesting is what happens and the challenges that happen when we get sober. And I want to take this as an opportunity to say that this is a great time to look at your life, and whether you are drinking or using too many medications or using an addiction in another way, because there's a lot of addictions that we can avoid life's big truths. Next slide, please. This is, I just loved Hemingway. He died of alcoholism, shot himself with a shotgun. But this is one of the great quotes, I think. The world breaks everyone, and afterward, some are strong in the broken places. And in some sense, the world is breaking all of us right now. We're all vulnerable, and we're all intensely aware of our vulnerability. it brings to home something that I talk in another talk, is there are no safe spaces. We're trying to build them at college and build them and make everything safe. Well, there aren't any. And this is what this message is, I hope, is that we can deal whether they're safe spaces or not. Next slide, please. My areas of study I went through are midlife growth, medications, political psychology, and post-traumatic stress disorder. I was in my residency when John McCain and the rest of the aviators were released from the Hanoi Hilton. So I've been looking at post-traumatic stress disorder and addiction through 4 wars. Next, please. Next slide. This is, I love this. I love this statement from Kierkegaard. What am I doing here? Why wasn't I consulted? I think we all kind of feel that right now. Why are we here? And this is where I think trauma starts. We're all, the most traumatic thing that happens to any of us is probably birth. We go from a comfortable environment to cold, helplessness, complete dependence upon the regard of an outside world. Whether we trust that or not happens early. And I have seen and grown to see medication and drug addiction as an attempt to make that little infant comfortable. I think in some ways you can look at alcoholism and opiate addiction as an attempt to recreate the womb in adulthood, to go back to where we don't have to feel anything. We don't have to, that we can be cared for completely. We don't have to hurt. We don't have to suffer. And that's not what we're dealt here. Next slide, please. Addiction and loneliness. This is one of the things that's really acutely aware, that we've become acutely aware of, I think, with this. And we are by ourselves. We've got to be now. More Americans live alone than any other culture. But these are the things that mitigate against addiction, against mental illness, and against suicide. The only things that really correlate. Do you have a family you love and who love you? Do you have friends you trust and confide in? Dr. Gadhia-Smith talked about that a little earlier. Do you have work that matters? Callings that benefit your neighbor, what the Buddhists call right livelihood. Do you have a worldview that can make sense of suffering and death? And we're really called at this time to deal with that last one. And that last one's the tough one. Next slide, please. I like this quote, and I'm going to read it. The kind of loneliness defined by an absence of meaningful relationships now plagues nearly half of all Americans. In fact, American loneliness has doubled since 1980. 1 in 5 Americans now report having no one to talk to when going through difficult times. Our isolation is so severe that former U.S. Surgeon General Murphy recently declared loneliness a public health crisis. And this is the opportunity, this plague is an opportunity to bring awareness to that, which I think is the biggest problem in our culture, and to do something about it. Next slide, please. Yeah, there are 2, someone asked for references. There are 2 I would recommend: Death by Loneliness and Real Clear Politics, The Empty Promise of Suicide Prevention. You're welcome to my slides. Next slide, please. Addiction and PTSD both are disorders or diseases of the ability to relate to others. And the treatment for both is relating to others. Addiction, a loss of authority over mental function. Persistent mobilization of the body and mind for lethal danger. Persistent and activation of combat survival skills in civilian life. Persistent expectation of betrayal and exploitation. The loss of basic trust, I think, is almost universal in addicts. and the destruction of the capacity for trust. Next, please. Yalom, I love psychiatry. I started out in critical care medicine and emergency medicine, and I went through the AIDS epidemic. We didn't know what PPE was, personal protective equipment. We went through MERS the same way. This is a more vicious plague, and the call to protect ourselves is much more intense. But we've been here before in this culture. This is not new. We have 7 billion people on the planet vulnerable to disease, and it's like a petri dish in high school. It's going to come again. We don't know when, but we don't have to die mentally over it. We don't have to become so anxious and paralyzed that we can't grow. Yalom says, and has these truths, 3 truths that are too painful to bear alone. 1 is we're really alone in the universe. We just talked about that. 2 is you really are going to die. That is brought home now. That is advertised at 6 and 7 and 8 and 9 o'clock every night. We can count the death. It's not a theoretical position now. We know that it's coming. It may not come with this one, but eventually it was. And that's not the worst thing in the world, and I'll try to get to that. The third one came out of Vietnam. It doesn't mean nothing. It's in a poem called Ozymandias, but the basis of that is 200 years from now, nobody will remember that we did this or that we were even here. So in that sense, we have to deal with the meaninglessness of it. Next slide, please.
This is a wonderful presentation, Dr. Smith.
Am I going to run over? How long do I have?
I think you have a few more minutes, and so that we can allow more questions from the audience to you and to Dr. Bebouth and to Dr. Gadhia-Smith.
Okay. Again, I'll repeat the alone. We're really alone in the universe. All of the anxiety disorders, generalized anxiety, phobias, agoraphobias are around that. If we can get somebody around us, we're not so anxious. Death, Dr. Bebouth talked about it, I think is dealing, that's what depression is dealing with, but that's another talk another time. The meaninglessness. But the fourth one is the tough one. You're responsible to deal with the above 3. And that responsibility is very acute right now for all of us. We can't avoid it. We can't go out and run from it. Next slide, please. We've got an ability to deal with it. The electronics have been wonderful. I think these Zoom meetings, what we're doing now, I think the world has changed. The loss of humor in this, that dark humor is really essential. We see that a lot in addiction. If they're able to laugh at themselves, it's freeing. That's another talk another time. The lack of meaning, the political correctness, I think we're overly concerned with that. I think we just saw that in the Navy in a relief of a command, another talk another time. It's interesting that our testosterone in the millennials is 50% of what it is in my generation. Another talk another time. But we are drawing back from life, looking for safe places where we don't have any. Next slide, please.
And Dr. Smith, I think we need to wrap up. If
okay, good.
Yeah,
good.
Thank you. I appreciate it.
Next slide. There are actions we can take. Anita talked about some of them, grief retreats. And next slide. But let me leave you with this and close with this. There's a quote by George Bernard Shaw. It's in the introduction to a review of Mrs. Warren's Profession. So this is the true joy of life, he says, to find a cause determined by yourself to be a mighty one, to be used up before they put us on the scrap heap of life, to become a force in the universe rather than a sniveling little clod of grievances and insecurities, complaining that the world does not make you happy. Now, to take that on now takes real courage, and all of us have it. I'll quit with that.
Thank you, Dr. Ronald Smith and Dr. Anita Gadhia-Smith, for your presentations. And the audience has heard about resiliency and promoting healthy relationships, some triggers that can be a stressor to relationships. And I want the panel to think about that thought as we get to the questions. I want to make sure there's enough time and the audience can stream in the Q&A box again. One of our listeners has been very patient. It was the question as to the taboo of mental health, particularly for people that are older. They had framed the question for the Asian Pacific Islander community, but our goal as a commission was really to talk about it as a whole for the entire DC community. So can we just speak very briefly, each of you maybe give a minute or so to talk about how you destigmatize the concept of mental wellness. And maybe Dr. Bebouth can go first before the Smiths.
Thank you. Again, I think Dr. Gadhia-Smith and I both had the same impulse about sharing, because I think the more you talk about it, the more normalized it becomes, the easier it becomes, and to resist the temptation to sort of secret away. So I think that's the number one thing. Yes, there are differences in terms of cohorts and generationally, but I think the remedy is for people to talk about it and to share and disclose. I think Dr. Gadhia-Smith talked about people coming to her and saying, "Are you sure you want to do that?" I once worked at a place where we were opening up an in-house pharmacy, and employees were welcome to get their prescriptions filled there. And I had colleagues who cared very much about me, who warned me against getting my antidepressant medication filled through my employer's in-house pharmacy. And I did it anyway, because I decided that I did not want to hide that. Thank you.
I'd like to weigh in. I think Dr. Bebouth said that 1 out of 4 Americans have a diagnosable mental illness over the course of life. I would say that if everybody doesn't have a diagnosable mental illness over the course of their life, they're not risking enough. They're not risking failure. They're not risking anxiety. It's just not a big deal anymore. I worked with the parity bill for 20 years to get it through, and we can say we're gay, we can say we're alcoholic, we can say we're in long-term recovery. People don't really notice or bother you very much, and we've really come a long way in that area.
I'd like to add something.
Okay.
If there's anyone out there and there's something that you don't want to talk about, find a safe person and go tell that thing that you've been keeping a secret your whole life.
Amen.
Okay, and I want to get to as many questions as possible, so I'm going to list 3.
Can I just say something about the kind of Asian American aspect of this? I think it was the original sort of thrust of the question, and that is just to offer a couple of resources. I think that some of the kind of national advocacy groups that focus on mental health do have emerging and or robust kind of presences of Asian Americans and discussions about Asian American mental health and Pacific Islander mental health. So for example, if you go to NAMI, National Association on Mental Illness, Ryan Tanup is there and has been doing some thinking about kind of APIs and mental health. The Asian American Psychological Association is a national entity, kind of a trade association that has resources as well. The national NAPIMA, the National Asian American and Pacific Islander Mental Health Association, they're kind of an advocacy group that fought for the parity bill as well. And then finally, NAPAFASO, specifically thinking about substance abuse. They're an organization that's based in LA. And if you Google them, and we'll include some of this stuff when we send out resources for everybody at the end. But I just wanted to sort of name some of the kind of main groups that are thinking about these things, particularly through an API lens. Thank you.
Okay, thank you, Ben. For the three questions that I see here, there was one regarding how we in our cabin fever manage our own feelings when we're frustrated with children or roommates. The second question is regarding what are some personality traits that we could identify as strengths to overcome PTSD. And lastly, a question specifically to Dr. Anita Gadhia-Smith about spending a difficult childhood to work to your advantage. With the time that we have, can we shoot for maybe a minute to address either one or maybe all three if you have insights?
I'd like to say that having gone through trauma or a difficult childhood creates more strength and resilience than anyone else can ever have. Because if you make it through that, even though you might not think that you have a lot of strength and resilience, you do if you've been through trauma.
Mm-hmm. And personality strengths for PTSD, any of the other two panelists?
The people that I've seen with genuine PTSD from 4 wars, 3 of which we probably shouldn't have been in by my value system, get out of it by love and service. There's a great film about that. There are a couple of films about it, but really the way out of almost all neurotic behavior is service to others. Find someone to help, to get your mind off your own neurosis.
Okay, and lastly, Dr. Bebouth, any tips on self-management when we have our cabin fever with kids and roommates?
Working at home, 2 of us teleworking and a 6th grader that's doing distance learning now full time. I have nothing to say about it. No, I'm kidding. I think a couple of things. My beloved has us set a calendar every morning, and both of us have many meetings already booked, most of them happening this way. But we set a calendar, and that's been very helpful with our son. He knows when I'm going to sit with him to do his math lesson, and she's going to sit with him to do Latin, or I'm going to listen to the reading for the day or do civics. That's helped. We've made a routine out of aiming for 6 o'clock, getting outside every evening. Those are just a few things, but I think routine, with thinking about roommates and so forth, people have to be more explicit about kind of what the rules of the road are when they're living together. Often we have all kinds of escapes, but now that we're primarily hunkering down at home, people have to be more explicit and intentional about how they use space, how they interact, and be more self-aware about what they need. And then finally, exercise, but also some mindfulness. A friend of mine is doing yoga every day, and never thought that he would do it, but has really found it very grounding.
And we have two last questions that are coming in at the end here. Dr. Bebouth, you said SMI, and an attendee wanted to know specifically what did that stand for, and describe the mild to moderate trajectory. And then the second question was regarding older residents in the community. How can we help them be well-versed in the social media?
Great, thank you. Others might be able to respond to that, although I know my mother's church is happening by Zoom now, and with my brother's help, she's figured that out and able to make meaningful connection that way. I apologize for using abbreviations and acronyms. I pride myself on not doing that, but I've been writing too much this week in my proposal. SMI is simply an acronym for serious mental illness. And primarily what I'm talking about there is psychotic spectrum disorders like schizophrenia, schizoaffective disorder, severe bipolar disorder, and severe depression. Serious and persistent mental illness that are really chronically debilitating. And again, all of these illnesses don't have to be. They can often, these are treatable conditions. Mild to moderate, I'm talking about things that are more universally experienced. Depression, anxiety, phobias, people who may be very particular and have some tendencies toward obsessive compulsive disorder are really challenged by the virus and the unseen, invisible kind of enemy, and washing hands and doing things compulsively. But SMI really refers to the more debilitating conditions, deep end.
Okay, great. And the other two speakers, did you want to weigh in on the last question about social media literacy for our aging population and how to be more inclusive during this time overall in mental wellness?
Well, I think that if they want to learn, then be patient and give your time and try to help, but don't force them to do something that, some older people don't want to do it. And, we have to respect that and just stay connected with them as much as possible, because they can feel very alone, and we need to look after that. And, just give each other grace and practice a lot of gratitude, and just remember to be grateful that the person in your life is breathing and alive.
And thank you for those last thoughts. I want to give our media person, James Yu, time to queue up the community resources from the Department of Behavioral Health. I also had texted into the Q&A box some resources, including SAMHSA, the Society of Addiction Medicine and Health Services, and NAMI, the crisis line there. And then AARP also has a coronavirus page regarding how to connect to affect. And then to reorient ourselves to the coronavirus web pages for resources at the CDC and DC Mayor Bowser. And now I'll turn the floor back to Ben in his closing remarks. And I thank the speakers as well as the attendees here on the workshop.
Great. Thank you, Karen. But before I start sort of an official kind of wrap up for this, I did want to mention a couple of other resources, specifically for seniors. The Department on Aging and Community Living has been thinking about, our seniors and how to support them during this time as a particularly vulnerable population with respect to the virus in particular. I think it's really important for us to think about that. So if you go to, if you find them on the internet, they have resources. One resource in particular actually is also done with the Department of Parks and Rec. And so at 9 a.m. every day and 3 p.m. Is it every day or is it Monday through Friday? I believe, well, it's weekdays. If you go to either the DC channel, channel 16, it's 1086 on Xfinity, which is my cable provider. There are fitness sessions. The 9 a.m. session is for seniors, and the 3 p.m. session is for children and families. So we've talked here about kind of the how mental health is health, and the other way is true. Also, Dr. Gadhia-Smith talked about taking care of your body as well, and so that is another resource that's out there in terms of exercise and that sort of thing. That leads me to thanking our mayor. Our colleagues across city government, Mayor Bowser, are all stepping up at this time. We wanted to point you all to coronavirus.dc.gov. It's really a one-stop shop that tries to be a resource for every aspect of city government that is related to the pandemic. There's data there, there's resources there about health, about small business, about recovery, about unemployment. We have translated here at MOAPIA a number of informational pages and fact sheets that have come out of that work into different Asian languages. And we know that some of it is translated into other languages as well. So if you go to that website, that will be helpful for you, hopefully. And then finally, I just wanted to thank everybody who joined us today. In the same way that we're all staying at home to make sure that we're all kept safe, taking care of yourself and your needs, it's like following the flight attendant's instructions and putting your air mask on first before you help others. We need everybody to be healthy in mind, body, and spirit to make sure we all get through this together. So we took a little bit of your time past 7:30, so thank you very much again. Stay safe and look after each other.
Just a quick just a quick last thought. First, there was a request from the attendees whether or not the panelists would feel comfortable sharing their contact information. And while I get a response back from them, I can type it in the chat box what they're willing to share. I know for the author, Dr. Anita Gadhia-Smith, her books were presented at the beginning. And then lastly, I'll let James queue up the feedback survey. Keep us accountable to your needs. Help us continue working hard for you in our efforts together for a healthy and safe DC community, and provide your feedback. This is a kickoff for the workshop series, and we're hoping that all the other ones will be successful based on your input. Thank you.
And just to add that the resources are, including Dr. Anita Gadhia-Smith's books and her website, will be included in the follow-up email, and recording will be shared in that email as well next week.
Yeah, so contact information, resources that were talked about tonight, all of that stuff will be sent to people, via email, everyone who RSVP'd tonight, and we'll follow up with you that way. So don't stress out, Karen, about typing everything down. We'll take care of it, and we'll make sure everybody gets information about tonight's event. So
thank you.
Okay.
Stay safe and well.
Thanks, everybody. Good night.
Good day.
Thank you, everyone. Thank you.
Thank you. Mhm.